Steve Adebayo here at St. Barnabas Medical Center. I am pleased to be joined once again by Dr. Hani Mansour, who's the medical director of the Wound and Burn Healing Center. Last time we talked about the burn side of the equation. Now let's talk a little bit about the wound side. Doctor, again, I was treated on the wound side as a patient, and it was an incredible experience, and I am not convinced I would have gotten better as quickly at any other place. Let me ask you this. The most common wounds that you treat at the wound center?
The diabetic foot ulcers.
Why is that?
The diabetes is a very complex disease where it affects almost all your system. One system that it affects is sensation in the feet. So that's why the diabetic patient gets an ulcer or gets a wound without feeling it and then does not take care of it because he does not have any symptoms from it. He does not have any sensation. So it snowballs. By the time he reaches the physician, it's already advanced. And in order for us to prevent it from happening, we have to really teach this patient when they have counseling for the diabetics. We always have to make sure that they check their feet, make sure that if they have a visiting nurse to come and check their feet every time they come to see them. And when the wound occurs, to seek medical attention immediately. The treatment also is to control the diabetes, which is giving them all these symptoms. If there's any problem with their health, is there any problem with delayed healing, it's because the glucose, the blood sugar is not controlled. And when you cannot control the blood sugar, you are at risk of poor healing, infection, and recurrence of diseases.
You know, as I'm listening to Dr. Mansour, what's striking me is that even while what goes on with the clinicians and the health experts at the center, a lot of this goes back to the patient and what goes on when the patient's at home, right?
Absolutely, yes, absolutely.
So you have to set them up to go home and do the right thing, or bad things are going to happen.
That's critical. That's very important. It's not going to heal without the patient participation, without the patient taking charge of his own body. If they can't, then we have to make sure that there's somebody who's keeping watch over them. We have to make sure that the visiting nurse goes and make sure that all is set for them to get the proper treatment.
And finally, on the wound side, a piece of advice for people watching right now on our website. We talked about the burn side, a lot of advice and prevention, burn prevention, wound prevention. Is there any way to avoid, if you will, wounds? Are they preventable?
All wounds are preventable, but it happens because that's nature. That's how it happens. When you have a wound, it's very important not to neglect it. It's especially if you have other diseases, if you have a vascular disease, for example, certainly if you have diabetes, you have to seek medical attention as soon as possible.
And if you don't,
it's going to get worse and you end up losing your foot.
And so act quickly.
Quickly and properly, yes.
And come up to St. Barnabas.
Of course, yes.